You're listening to the We Are Libertarians Podcast Network. Find all of our shows at wearelibertarians.com. Welcome to Now Hear This. I'm your host, Chris Spangle. Now Hear This is a conversation with leaders in Indianapolis that are working to improve the lives of Hoosiers, and our goal is to empower you to join in their work and make a difference while informing you about the unseen aspects of life in Indiana. If you miss any episode of Now Hear This, you can listen on our podcast feed or at nowhearthisindy.com. With COVID-19 starting to impact the Hoosier state, we're going to use that podcast feed fairly regularly. And so please be sure to get frequent updates by subscribing to that and checking that website, because we're going to talk to many different leaders that are managing the response to the COVID-19 crisis. And the person where we want to begin the conversation is with a very qualified person. It is Mary Kay Foster, manager of the Special Pathogens Unit at iHeart. Good morning, and thank you so much for joining us.
Hi, good morning, or good afternoon, I think it is now.
Yeah, so let me ask, what is the Special Pathogens Unit at iHeart?
So this is designed, 5 years ago we had the largest outbreak of Ebola in West Africa, and many centers around the country created these special biocontainment units where somebody that has a very highly infectious disease that requires maximum protection for the healthcare provider to stay and be taken care of effectively. So we have a unit here at Methodist Hospital. It's been here for the last 5 years, and we're always ready to go when there is a highly infectious disease that is warrants being in this kind of a unit. So those one-off patients are our biggest group for this kind of a unit. Not your typical pandemic-type setup like what we're seeing now. So I wish we had more beds for that, but we do not. So
do you essentially start to help train a lot of the other doctors? I know that a lot of elective surgeries have been cut short. So does your unit then begin to give crash courses on certain things to other parts of the hospital? How is iHeart preparing?
So, I've become an expert in what type of personal protective equipment and the procedures on how to put that equipment on and then how to take that equipment off, and do so in a manner that will reduce any risk of contamination to the healthcare provider. So with my background in this area, I have for the last 6 weeks actually been working toward what type of personal protective equipment do we need? How do you creating those educational tools to help train everybody? And it's not just nurses and doctors. It could be the environmental service people. It could be our people that deliver our meal trays may need to learn how to do this. So everybody in the hospital, whether they have to be in a gown and a mask or just maybe a mask, we make sure that they know and understand what we're doing and why we're doing it and how we're going to keep them safe.
So we'll revisit that in a moment, but I want to start at an elementary level for people. Can you explain what is COVID-19 and what makes this different than the regular flu and other diseases? We're effectively shutting down the economy for at least 2 weeks. Why is this so dangerous, and what is it?
So the coronavirus, there were 6 known coronaviruses. 4 of them caused routine cold virus-like symptoms. So they circulate every single year. People can catch these at any given time. There are 2 that are a little bit more dangerous, and those are the SARS from 2002, the Mideast respiratory syndrome, which is we see cases in the Mideast of the Arabian Peninsula. And then now this 7th one, which the disease is called COVID, but the virus itself is SARS-CoV-2. It's SARS-CoV-2. And it's new. We've never seen it before, so we've had no exposure to it. When you see something new like this, the first thing it's going to generate is fear and panic. We don't understand, and we're slowly beginning to understand how this thing spreads. What do we need to do to protect ourselves? What is the case fatality rate? those are the things that we have to figure out, and we're slowly getting there. But nobody's had exposure to this, so our bodies they're not, how do I want to say this? They're not been exposed, so therefore they don't have any way to fight it off. Like with the flu vaccine, you build up antibody, or, you build up that ability to fight it off or not get infected. Trying to think of a better way of putting that.
Sure, yeah, it's sort of what you learned in grade school. You've got, correct me wrong, you're the nurse, but you have the white blood cells, and it makes sense. Like when you get a vaccine, your body starts to kind of build up an immunity to it. But this is
exactly.
Just radical.
That's the word, immunity. That's the perfect word for it.
Yeah, and so
we have no immunity.
We have no immunity, and so is that why it is so destructive? And so, first, let me ask you this, because I know that there may be a portion of our audience who just doesn't think that this is a big deal, and we're taking catastrophic measures for no reason. Everybody's kind of overreacting. What would you say to that person who's listening to this?
We're not overreacting. If you look at 100 people in a room and everybody gets infected, 80 of those people are probably just going to get either no symptoms or mild symptoms, maybe a cough, but they're going to be able to stay home in their houses, kind of self-isolate. 20 of those people are going to end up in a hospital with pneumonia. And maybe a handful of those are going to have severe pneumonia, or multi-system organ failure, and may not make it back out of the hospital. The one thing that we're still struggling with this is trying to figure out how many people, kind of what that case fatality rate is. With SARS back in 2002, the case fatality rate was around 8%. That's pretty high. With the MERS virus, it's running about 30 to 35%. And right now, we're thinking with this COVID-19, we're looking at about a 2.5%. So not as dangerous as the two previous, but with the flu, the flu is really bad, and it's still really bad. But even then, our case fatality rates are not that as high as even 1%. So it's dangerous in the fact that that's new, and it may be that you won't get really, really sick with it. But if you're around to somebody else that catches this, it could impact them tremendously, up to and including death. So my goal is to say that just do what we need to do to keep everybody safe. It's about the people that you may not know who could be really negatively impacted by this.
So how does it spread? So that number, that 2% versus 30%, that makes it sound like, it's not as dangerous, but is it the speed? Is it the virality of it? What makes this so significant?
Well, one is, how does it get spread? And we think that it's droplet. So when you cough or sneeze, you spread droplets about 3 to 6 feet outward, and then they fall down to the surface and stuff. They're still trying to figure out if there's any airborne, so microfine particles that you coughed out that kind of linger in the air. So that's called airborne spread versus the droplet. And then there's the contact where those droplets have fallen down on the surface. You grab the handle to the door, or you touch that railing and somebody's just sneezed in their hand and touched that. Then you put your hand up by your face, and that's how you can infect yourself. So there's 3 possible ways, and we definitely know that it's droplet and contact, but we're still trying to determine, is there an airborne component to the spread? Now, airborne, to compare that to it, so measles is a good representation, or TB, but with measles, you spread measles, up to about 24 to 48 hours before you become symptomatic. And it can hang in the air for up to 2 to 3 hours. And anybody walking through that space can be breathing those particles in and can get infected. So that's where the difference is between airborne and the droplet. So,
So with
I don't know
this,
if that helps explain it like that.
Yeah. So but we have immunity to measles because most of us were vaccinated as kids. I know I was before I went to school, and so you walk through that cloud and it doesn't affect you. Whereas with this, because there's no immunity in the human species, basically, it's really aggressive, and so the word that a lot of us have never heard before that maybe you've heard is social distancing, and we seem to be taking it to a very aggressive level, which if that prevents lives, I'm okay with it. The term is social distancing. Why is that necessary? Why are quarantines in society necessary? How does that affect the spread and the rate of it?
Okay. So if we didn't do social distancing, so what if we had the NCAA championship this weekend downtown? 50, 60,000 people there. They have people that are coming in that have COVID but don't realize it, or they just think they have a cold because that's what it feels like. They come in and they infect potentially thousands of people. Say 80% of those will go home and say, oh, dang it, I caught a cold while I was at the championship. But 20%, maybe that's 2,000 people that are going to want to come into the emergency department because they are acutely ill and need to be taken care of. Can you imagine in the emergency departments that, or the hospitals that are running, around 80 to 90% full most of the time? Can you imagine 2,000 people swamping all of these hospitals in central Indiana?
So let me ask you a clarifying question before you continue. A hospital like, let's say, Methodist, how many beds does a Methodist have? So you're saying 2,000 people. How does that apply to our current, and they're 80% full, how many beds are in a Methodist, to give us an idea?
So on any given day, we have around 475 beds. And usually about 425 to 450 of those are pretty full on a regular standard day.
Okay.
So by doing the social distancing, canceling the championship, which, believe me, my husband is in mourning just like everybody else is, that prevents the 2,000 people that might be coming into the ER. It prevents them from getting sick. And yes, there's going to be low-level, infections happening, but instead of a huge spike of patients coming in, you might have heard this kind of flattening the curve, so that we have a steady number of people coming in over a longer period of time, and we can take care of them better and more effectively.
Okay, so that makes sense. And so is there also a part of this flattening the curve concept that is trying to give us some time to figure out what might best work? I know I've seen, I'm not sure if the medicine is chlorinique or hydroxychlorinique. If it's been shown, Johns Hopkins has said that this may be effective in some ways, or maybe we're trying to ramp up the amount of ventilators that we can create. Is the shutdown also partly to give us time, delay time, so we can find out from Europe what exactly is happening, get some of these numbers? Because early on you're like, well, we don't know this, we're not sure about this. Is part of it so we can get to a place where we have an idea of how to effectively treat this and delay that explosion, that spike.
And that's an excellent way to put it. So what we're doing is buying ourselves some time. One, to understand what we're dealing with. Two, to prepare our nursing staff, get the supplies that we need as best as possible. And two, also allow us to look at what can we do to treat this? Is there a medication out there already? There's some other antivirals that I think that they're looking at, so maybe repurposing something that's currently being used or developing something new. And then all important, the vaccine, which, it will take 9 months to a year and a half to get a vaccine made, validated, and a big enough production to be able to begin to vaccinate people out there. So, that's not an easy fix, but anytime that we can buy time to prepare is just it's so important to save lives that way.
Right, because, and I want to ask what you've seen in places like Italy or Singapore or Japan or other countries or China. It seems, as I have seen it explained, that it is the amount of ventilators, it's the amount of beds, it's that it hits so overwhelmingly quickly that it overwhelms those staffs, and that decisions then are made about who gets the ventilators and who doesn't, and that is the part that maybe the disease kills 2%, but it's the lack of resources that kills far more. So what have you seen as you're prepping your hospital? Give us some context of what you're seeing in other countries that you're enacting at IU Health.
So, actually it's not IU Health. I think it was back in 2014 through 2016, Indiana State, our government here, as did many states, worked on what they call crisis standards of care. And if something like what we might be facing starts occurring, is providing some guidance to making tough decisions. And so our state government has things like that already defined. They, of course, are being looked at. And, if it got to a point that it's really bad and resources become very thin, and you're right about the ventilators. With these patients, about day 8 or 9, they are starting to feel a little bit better, and then the pneumonia sets in. So that can be more of a, that's when, they might be in the hospital.
So 9 days in, that's when the ventilator comes. 9 days after showing symptoms is when it becomes dire?
Well, that's when they start to develop more respiratory symptoms. The pneumonia might set in. They might develop respiratory failure and need the ventilator.
Okay.
Not always.
right.
But that's when, that is what they've seen in literature happening in China and Italy and other places.
Okay. And so how do you prepare for something like that? Are you just trying to supply the hospital as much as possible?
Very much so. But what people don't realize is that our country and our, state governments have been preparing for things like this for many years. So we're not just, Methodist Hospital, but the state has a cache of supplies. We have a healthcare coalition that has supplies. We have the national stockpile that can be accessed. And then, of course, the military also has available resources as well. So there are, there's equipment out there. So, but again, if we can slow this down, then we'll have enough to get through this.
Okay, and I think that gives me hope, and I think that's kind of what a lot of people are feeling. It's like, okay, it's the medical, is our medical system ready for this? And that just left me with a lot of hope. I mean, is there anything else that you'd like to add to the hope bucket?
No, I think there is hope. I tell you, there's nobody more dedicated than a bunch of nurses and doctors faced with tough situations. They're going to be here, away from their families, providing excellent care to the very best of their ability. And, I think we need to remember that, things are probably going to get a lot tougher before they get a little bit better, but, they're doing everything they can. We're looking at every possible option for supplies and equipment and things like that to have available. So, again, this early social distancing, canceling everything, just telling everybody to stay home, that's why that is so important. Now, I'm not getting why the push to get toilet paper, because I can think of other things I need more important than toilet paper at the house.
And wait until you run out.
Some of this panic, is because people don't understand, and they're scared. I'm scared that doctors and nurses are scared. We're all faced with something totally new. But if you plan and you prepare and you trust that we're going to do the right things and get through this, we will get through this.
You're listening to Now Hear This with Chris Spangle. I'm your host. And I am talking to Mary Kay Foster. She is manager of the Special Pathogens Unit at IU Health, and their website is iuhealth.org. You know, one thing that I have seen out there is going back to I think I had this in January. How did we kind of discover... I saw one epidemiologist on Joe Rogan, who is the main news source for America now, say that this jumped into humans in the third week of November. And when did we start to find out about COVID? And, you know, how do we know that this is special and different?
So, as they're looking back in China of symptoms that people may have had by just, chatting with them. So, yes, it may have easily started in November when it went from animal to animal to somebody being able to infect a human. And then maybe that stopped there, but then maybe the next time the human got infected, that virus changes, and then allows a human then to spread that virus very easily to the next human, and then to the next human. So we were China... the doctors there realized in very late December that they were seeing a cluster of patients with severe pneumonia that they could not identify an actual cause. So we can do viral respiratory panels and eliminate a lot of different types or rule in what it might be. And, they were not seeing any, regular virus that we know about. Of course, they checked for the Mideast, and they, checked for SARS, and they were all coming up negative. So then they, the information was getting out, and they realized that they were dealing with something new. And then they were finally able to isolate the actual virus and grow it and realize that they had a coronavirus. Corona means crown, and when you look at this virus, it's very much like the pictures. It has these little spikes that have like little crowns on them. And that's where the name coronavirus comes from. So this probably originated in a bat. Bats routinely bite animals for their blood meal, and that's something that's been going on for eons of time. So for some reason that this virus managed to go from the bat to the animal, probably lived there for quite a while, and that for some reason it was able to mutate and change enough that it affected a human and then allowed human-to-human transmission. So everything that we're seeing or experiencing from the first of the year is not COVID. It is our normal respiratory virus season. We've actually seen this flu season has been actually really weird because normally what we see is influenza A at the beginning, and then when it starts to go off or slow down, we might see influenza B kick in. But this year we've actually seen influenza B spike very early, and it hits our youngest people, our kids, really hard, and then it started to come down, and all of a sudden we're seeing now a spike in influenza A, which is H1N1, which really impacts our healthiest population, the 20 to 50 or 60-year-olds. So it's just been one of those really unusual flu seasons, and I don't think that we've seen it circulating here in the United States. Probably, we might have seen some spread coming in that we didn't realize that's what it was. Probably, let's see, we're mid-March here, maybe mid-February and stuff, just from travelers, because we weren't screening travelers at that time, or even in late January, because we didn't realize what we were dealing with and people were traveling. And again, most of these people have very low-level symptoms in the middle of a respiratory season, and it doesn't ring as this is something new.
Right. So the Facebook doctor that says, I've been seeing this since late December, that person's probably not correct.
No. What they're seeing is our normal influenza season. If, they're checking for flu, and it depends on testing. So if somebody comes in and is like, oh, doc, I feel horrible. I've got chills, I've got a fever, I got a cough and stuff, and the doctors are going to say, well, look at you, check you out, and they're going to say, well, you probably have the flu, you need to go home, bring fluids, take Tylenol as needed for aches and pains and fever, get some rest, eat your chicken noodle soup, and you'll get over this in the next 5 to 7 days. So we don't routinely check all these people anyway. We treat them as the flu. It looks like the flu. It acts like the flu. It's the flu.
let's talk about what it feels like as it starts to move into the Indianapolis area. We've seen 2 deaths so far. We've started to see an uptick in cases. And let me, before I ask my question here, have we seen an uptick in cases? Are you seeing more and more people over the last couple weeks? Where are we at in terms of the beginning of that, what's called exponential curve, as I've seen it explained?
Well, when I checked the website this morning, and I haven't checked it this afternoon, we were at 30 cases. I think there were at least 7 in Marion County. We are starting to see an increase, but I don't know that it's because we've got more disease. We just have a better ability to test.
Okay.
That has been the limiting factor up until now, is that we've been very selective on who we test. So remember, 80% of the people that get COVID-19 will just have a common cold-like symptom. And remember, right now, we're very much in the depths of a really nasty flu season. And honestly, I think everybody that we have tested for COVID have come back actually with influenza. And still very, very sick with that. So that's that. If anything has been bad in timing, it's the timing that this is happening in the middle of our respiratory viral season. That just makes it hard to say, is that the flu, or is that one of the other 20 different viruses we catch every year, or is that COVID? So now that we're testing, the ability to do more testing is increasing. That we will start seeing more numbers of positive cases just because we're testing more.
But that's not necessarily a reason to, if you start seeing more, it's not necessarily a cause for concern. It just means that tests are more readily available.
Exactly.
Okay. So I have had more people in the last week say to me, I think I had it in January. And I think part of that is just sort of a psychological preparedness thing. But as you mentioned, the flu season, allergy season is kicking up. I woke up with itchy, watery eyes and sneezing, and I was like, uh-oh, I've got it. And then I took a Claritin D, and my symptoms cleared up. So what are the symptoms? What are the initial symptoms that people ought to understand? And how do they know that they're experiencing it or the flu? When should you seek out testing? How do you know?
So that is probably the toughest question, because right now the symptoms for COVID very much mirror exactly what you get for any other respiratory virus or influenza. Achy, chills, fever, cough, more of a dry cough versus a wet cough, shortness of breath. Those are the main symptoms from, some people have had some nausea, but those are the main symptoms that people generally have. So if you're not acutely ill where you're so short of breath or you're wheezing, you're having chest pain when you're trying to breathe, if you can't keep fluids or food in, those are the things that should drive you into going to the doctor or the emergency department. But if you're doing fine, a couple days rest at home, you'll probably be back on your feet. Then the chances, it's flipping a coin right now. It could be COVID, but it could be any of the other, like I said, 20 different viruses. If you're fine, just stay home. Drink fluids, take Tylenol or ibuprofen for your fever, get some rest, eat some good foods. If you're having any of the worst symptoms I mentioned, the extreme shortness of breath, chest pain, not being able to eat or drink effectively, you're not putting out as much urine. Those are all symptoms of being dehydrated. Those are the things that even with flu, that's when you should go seek out medical care. Now, IU Health has a virtual app. So when in doubt, you can go to your phone and set up an appointment to actually talk to a doctor or nurse practitioner live, and they will screen your symptoms and then determine whether or not you need to go to the emergency department or if you should just stay home. And then they'll see if you have a lot of symptoms, you definitely had contact with somebody that does have COVID-19, they may go ahead and do a test for you. If you traveled overseas, you're going to have to stay home for 14 days anyway. They may do a screening test for you then. But what I would advocate for, unless you're acutely ill and you are having any of those symptoms, work through your physician office instead of going into the emergency departments. We're really trying to minimize the impact to the emergency departments by pre-planning these people coming in, and that we know that they're coming so we can get them in and out, that we have everybody in protective equipment so we can keep everybody healthy.
Because is one of the concerns that once tests become available, the news starts reporting on that everybody's going to rush to the ER to get the test, and then all of a sudden they're walking out with COVID when they just had an allergy or the regular flu. Is that something?
Oh, that's a possibility. I mean, you know, just sitting, in a closed-in space, within 6 feet of each other, that increases your risk for any respiratory illness. So that's why doing this online video health check is really important. Not rushing to the ER just because you got a cough. You're healthier to just stay home if you can.
Okay, and that is iuhealth.
And you should.
Yeah, iuhealth.org, and you can find that in the app stores. That is it's virtual screening. What do you know the name of the app?
iUHealth Virtual is my understanding is what it's called.
Okay, so
virtual app.
Yeah, so just look up iUHealth, and you can get that screened. So you mentioned ibuprofen, and I saw The Guardian in the UK report this today that ibuprofen is not necessarily helpful and may make some things worse in regards to this. Have you seen any research on that? Is that one of these old wives' tales that's running around the internet? Like, what are some common maybe things that you should debunk? I mean, I don't want people out there to see that article and go, I'm not giving them ibuprofen, but that may be necessary, or the inverse. So do you have any insight on that?
I don't, but, I think as we begin to, more people get infected with this, we work through their symptoms, any medicines that they're taking, we may see things like, is ibuprofen, a concern for making things worse or not effective at all? I think we'll learn these things. I've not seen this particular article. My husband actually reached out yesterday in his line of work, and they were questioning about certain allergy medicines. Can that create false positives when they go to swab you? And I'm like, I have not seen anything like that. So I think all that kind of information, unless the CDC is saying, this is absolutely do not use this, I would just take it for a grain of salt, baby.
Okay. I'm the son of a registered nurse, so it's been drilled into my head that you should not just eat over-the-counter medicines like candy. So
that is correct.
Yes,
that is correct. So you would only take the Tylenol for if you have a fever and you want to bring it down. And again, if you have a fever that isn't is staying pretty consistently high, and you're taking medicines to reduce the fever and it's not effective, again, that's another reason to call your doctor and say, I'm really sick.
So what are the current levels of tests? Because this has been a hot button issue in the political world, the availability of tests. Where's your hospital, iUHealth, and your network at in terms of the tests that you need? Do you have enough? Do you need more? When are they coming? And just give us some insight on the levels of testing there and versus the need.
So, we're still, our primary source for testing right now is the Indiana State Department of Health lab. There are several different outside labs. One is ARUP in Utah, and then Quest is another lab that created a testing modality, and you can use that. I am hopefully with either today or within the next couple of days, iUHealth Pathology Lab will be doing in-house testing, so and that will be great, so that we can then hopefully start testing more people. So that's where we're at with testing at this time.
Okay, so final question before we wrap up, and we thank you so much for your time. What should everyone listening understand that you see on a daily basis, but the public might not? Don't
panic. Develop a plan. There's great resources on the cdc.gov that you can use if it's like, I don't know what I should do. Go to a source of truth. That's the CDC. They're going to help you, with all kinds of information, what you should do and not do. Have a plan. Really reach out to your neighbors. If you've got a set of elderly neighbors around, check on them. Make sure that they've got food. If they don't, maybe, if you're not one of the high-risk categories, offer to go to the grocery store and get groceries for them. Be kind, be patient. We are all going to experience something that most of us have never had to experience before. So this is learning for all of us. I mean, the last time I think they practiced social distancing and canceling a lot of these events was probably during the 1918 Spanish flu. So, these are things that are proven that work. And, again, just be understanding. It is going to be more difficult. It will get more difficult before it gets better, but we will get through this. Your hospitals, your public health partners, the State Department of Health, all of your local county health departments, they are working around the clock to put plans in place and to be there to assist you. Since we have so many people right now that are off work, we're asking you to stay home. If we find somebody that needs resources, they have things that they can do to help provide food, make sure that they're getting their medications and stuff like that. So reach out to your local health departments if you have concerns about your medicines or getting food. There are resources out there. And, like I said, just be kind and be patient and be understanding.
Mary Kay Foster, manager of the Special Pathogens Unit at IU Health, thank you so much for your time.
You're welcome anytime.
And again, their website is iuhealth.org, and you can get that virtual screening app to see if you need a test or if a loved one might need a test. Please do that today. Be prepared. Thanks for listening to Now Hear This. I'm your host, Chris Spangle. If you missed any portion of our program, you can listen on our website, nowhearthisindy.com. If you'd like to have your organization featured on the show, please contact Gabby at 317-475-7407 or via the contact page on our website. Thanks for listening, and we will be back again next weekend with Now Hear This. Confused about the news? If you want to sound smarter when talking with your friends, our mission at the We Are Libertarians podcast network is to inform you about the world in an independent and irreverent way. We take current events far more seriously than we take ourselves. Get all 9 of our shows at wearelibertarians.com or in any podcast app by searching for We Are Libertarians.